Thank you for joining Cancer Support Community Atlanta for this program. Please visit our website, cscatlanta.org, for a complete list of live and recorded events. We invite you to sign up for our newsletter to stay connected to all future programs.
All right. So just a reminder, this is brought to you by the Cancer Support Community as well as the Northside High Risk Program. But also, in case we haven't met or we missed the first session, I'm also Northside Hospital Cancer Institute Survivorship Dietitian. So what I spend most of my time talking about is how we can reduce that cancer recurrence in the survivorship stage, as well as helping to balance some of the other side effects and symptoms from treatment that you might still be experiencing once you're considered cancer-free or in that surviving and thriving stage. All right, so it's week 4. So we've talked about the guidelines for cancer prevention, embracing a plant-based diet, evaluating the research, and now talking about, like I said, survivorship. So specifically what we're going to cover today, just so you kind of have a heads up of if there's any specific topic you're hoping we talk about. First, what we're going to discuss is specific nutrition interventions for some common side effects following treatment. So some of the side effects we experience in the early days after treatment, and some are a little bit more long-term or last for a little bit longer. So hopefully, not every side effect that we talk about might apply to you, but maybe there'll be some little nuggets of information that are going to be specific to you and in your health situation. We're also going to talk about a couple strategies to prevent and reduce risk of other chronic diseases. And lastly, we're just going to briefly touch on those 8 to 10 recommendations for reducing cancer recurrence. All right, so without further ado, let's talk about your nutrition goals now that you're a survivor. As you know, depending on what your treatment was, whether it was chemotherapy, radiation, surgery, or none of the above, typically when we're battling cancer, we're in the depths of it, our goal is to maintain our body weight, including that lean muscle mass, as well as maintain our body's store of nutrients. That way we can keep our body strong, help reduce fatigue, keep our immune system going through treatment. Well, after treatment, your goals shift a little bit. We still want to manage any side effects that are lingering and any weight changes that may have occurred during treatment. So, for example, maybe you went through treatment and you unintentionally lost some of your body weight, maybe some lean muscle mass, and now your goal is to bring that back up to your pre-treatment body weight. Or you could be on the other side of things, and maybe your particular cancer, you didn't lose any weight, but your care team or you personally are wanting to lose weight in order to help reduce cancer risk in the future. So weight management might be a goal after treatment. And a lot of times our treatment or long-term medications we take after our initial cancer therapies might put us at slight increased risk of other chronic health conditions. So things like osteoporosis, bone health will be so important. Protecting our heart. So we have, Heart Healthy. This is Heart Health Month in February. So I wanted to highlight that. Or maybe you were on steroids for a long time and now your blood sugars are high and we're trying to get those back in normal limits in order to help reduce the risk of developing diabetes. And lastly, of course, we all want to make sure that we're never going through primary cancer treatment again. So we want to do what we can to help reduce cancer recurrence while recognizing that, there's only so much that we control. The best thing we can do is the best thing that's for us in the moment. So what are some of the common side effects of cancer treatment? This can be a wide variety of things. As I mentioned, weight loss, or in some cases, weight gain may have occurred. You might be feeling really tired. Your body's been through a lot with radiation or chemotherapy. Or maybe you're having different, changes in your bowel movements. We're struggling with either constipation, perhaps from some medications we're taking, Or maybe we had a surgery and we're now struggling with the opposite. We might be struggling with diarrhea. Or maybe we feel like our head and neck has changed, depending on where the cancer was and where we had radiation. Maybe we're experiencing some dry mouth or swallowing difficulty. So, like I said, this is just a couple of the side effects. And so I'm going to cover some heavy hitters, some of those that I see a lot in my practice, and give us some tips to hopefully help make this transition a little bit easier. Okay, so a very common side effect, especially with many chemotherapies, is going to be decreased appetite or early satiety, meaning you get full really quickly. So maybe you've only eaten a small portion and you just feel like you really can't eat anything else. The number one strategy to help with this is to try to eat 5 to 6 smaller meals instead of 3 bigger meals. So this can look like maybe eating something smaller every 2 to 3 hours. A lot of times when we eat smaller amounts, you don't feel quite as full and it feels a little bit more manageable to eat again in a few more hours. In order to accomplish this, we want to make sure we're scheduling our meals and our snacks instead of waiting for our body to tell us when we're hungry. When we've gone through prolonged periods where we're not eating quite as much, our hunger and our fullness hormones don't work quite the same. They're not working, they're not firing on all cylinders, if you will. So they're not always reliable signals of when we should be eating. So if you don't really have much of an appetite, but there's not, too many other issues affecting your ability to eat, then go ahead and schedule them, set some reminders on your phone to help you stay on track. Another key point of helping to make this manageable is keeping your pantry and freezer well stocked with foods that are going to make quick and easy options. So think things that are, pre-portioned or ready to go. You don't have to prepare every single time you're eating 5 to 6 times a day. Maybe you've made a big batch of chili and you've frozen it or prepared a casserole that you can heat up throughout the week. Things like pre-chopped vegetables, of course, making sure we've washed them thoroughly, guacamole cups, individual peanut butter crackers, things like that. We want to be handy so that when we are feeling like we can eat, the fatigue component isn't additionally preventing us from getting our nutrition in. You can also eat a bedtime snack. This helps to make sure you're getting some extra calories at the end of the day without affecting your appetite at your next meal, since breakfast or your first meal of the day is probably, maybe 8 or so hours after the snack. If you're really struggling, 5 to 6 or 3 meals a day is not happening, we want to make every bite count by choosing higher calorie foods, things that have maybe healthy fats for more calories if you can tolerate that, or higher protein options in order to really maximize your nutrition when you're able to eat. You also can use your liquids to your advantage. So you want to drink your liquids throughout the day, even if you don't feel like eating. And sometimes you can choose liquids that add calories like a juice or a milk or a protein shake in order to help you get hydration and some extra nutritional benefits. But on the opposite side of things, you want to sip on the liquids throughout the day, but you may need to space them out about 30 minutes apart from your meals. That way you're not filling up on water or some other beverage, which may prevent you from feeling like you can store food in your belly. So we might want to separate those so you're not feeling too full from both the liquids and the solids. Okay. So as I mentioned, bowel habits oftentimes change when we're going through cancer treatment. So similar to the first recommendation is we want to make sure we're eating around the same time every day to help treat constipation. This is because our body, including our GI system, really likes routine. It likes knowing what to expect. And if it anticipates having to process or digest food at certain times, just makes that process a little bit easier. And it might help you get on a little bit more of a bowel routine schedule. Staying very well hydrated is going to be especially important with constipation. So for most people, needing at least 8 cups a day. but your specific liquid recommendations or needs might vary based on how tall you are, you know, your age, maybe any other health conditions. But 8 is usually a good baseline. And you can choose warm or hot liquids like a decaf tea or hot water as a little bit of a stimulant, and that might help you use the bathroom as well. Okay. Of course, fiber is a key component of constipation. If we're not getting enough fiber, fiber, certain types of fiber, our body doesn't necessarily utilize. It's not storing it. This is called insoluble fiber. So this is what helps to kind of bulk our stool up, make it a little bit more solid, and helps it leave the body because your body can't store it, so it has to go somewhere. So women, we recommend eating about 25 grams of fiber a day, and men 38 grams of fiber. And this is, of course, if you don't have any other, condition or maybe surgery on your colon or something that's preventing you from consuming more fiber. This is just our general recommendation. If you're not getting anywhere close to that amount right now, that's okay, but you might not want to completely add it in because that might cause a little bit of discomfort. You might want to slowly increase your fiber intake over the course of a couple weeks. So if you're starting at maybe 10 grams of fiber on average a day, maybe this next week we try for 15, and then the following week after that, maybe 20, and so on until we can comfortably have that full fiber recommendation in. But on the opposite side of things, maybe you're not struggling with constipation. Maybe we're struggling with diarrhea. In this instance, we might want to slow down our intake of those insoluble fiber foods and instead choose blander foods. We also are going to want to avoid really high fat foods as well as spicy foods. These can be a lot harder to tolerate, and they might go through your GI system a little bit quicker. So we want to kind of stick to that bland, low fiber. When you are experiencing diarrhea, you're losing a lot more fluids than you would with a regular bowel movement. So we want to be really diligent about replacing the liquids, those fluids that we've lost. So things like broths or sports drinks or electrolyte packets might help you to replace some of those nutrients. A good rule of thumb is for every episode of diarrhea, try to get an additional 8 cups of water. No, I'm sorry, not 8 cups, 8 fluid ounces or 1 cup of water to help kind of replace what you lost. There are certain foods that have a kind of fiber called soluble fiber that can help thicken our stool. So this could be a great option to help so that we're not losing quite as much fluids when we're having diarrhea. So some examples are banana, applesauce, and oats. And there's even some products on the market. There's one called Banatrol, which is basically concentrated banana flakes that you could sprinkle in something like an applesauce or a low-fat yogurt or an oatmeal that can help to thicken the stool so that it's not going through you quite as quickly. Many folks experiencing diarrhea also find that lactose, so that carbohydrate that we find in dairy products, as well as really sugary foods and sugar alcohols like sorbitol, might also worsen the diarrhea. So pay attention to that. If you're struggling, if you feel like you're doing everything else right, maybe there's some sneaky ingredients in some of the products you're choosing, like maybe they are putting sorbitol in some products, and that might be exacerbating the situation. And again, opposite of the recommendation for constipation, while we still want to stay hydrated, you might want to limit those hot and caffeinated beverages since they do act as a little bit of a stimulant. And lastly, you can always review your medications with your care team and see if there's any that are containing extra magnesium, because magnesium can also stimulate bowel movement. So if you're getting too much, that might be contributing to some diarrhea. Okay. All right. One of the most common symptoms or side effects of treatment, or really a cancer diagnosis in general, is fatigue. And I say from a diagnosis in general, because oftentimes just the burden of going back and forth from doctor's appointments, even in the survivorship stage when we're really monitoring and surveilling your health, or the stress of the diagnosis can really take a toll on our energy levels and cause us to feel very fatigued. So, some strategies here is try to get a great support system around you. So, if you have family and friends nearby, or maybe someone at your church, or if you're in a book club or some other social group, have them kind of rally around you and see where there's potential to maybe ask for help. Support groups are another great place in order to just get that additional support and maybe make some connections that can step in for you in this situation. But specifically, when it comes to nutrition, one tip is try to cook in bulk on days when you have more energy, or maybe even time of the day where you know that you have more energy. So if you're feeling the most energetic in the morning, that might be the time for you to make your meal prep, or even go ahead and mostly prepare your dinner or your lunch. So all you have to do is heat it up when you're ready to actually eat it. And freezing it, like I mentioned, keeping that fridge and freezer stocked will really help. Try to take it one day at a time. If you didn't get great sleep or you're feeling really tired on Monday, that's okay. Try not to let the stress of fatigue affect you too much. Look at the next day as a brand new opportunity to try and increase our energy levels. Again, keeping an eating schedule is going to be really important because food is our body's main source of fuel. So if you're not eating very much, I would anticipate our energy levels to drop. Maybe your blood sugar might drop, or really, you just don't have the energy from calories to help you work at your highest potential. So stay on that eating schedule. If you are able to restart or continue some kind of light physical activity, even if it's walking or taking 5 to 10 minute walk breaks every couple of hours or stretching, really moving has been shown not only in research studies, but also in my experience working with patients in the survivorship stage. A lot of times, adding that piece in is really what helps to kind of turn things around. Of course, the part of that is so important is if you've been cleared by your physician, to go ahead and incorporate physical activity. And I know that this can feel really overwhelming because if you're feeling fatigued, the last thing you do is, or want to do, is get up and move around. So getting started sometimes is the hardest part. So again, this might be a place where you can enlist the help of family and friends to kind of motivate you, or maybe to walk with you in order to kind of get this started. And hopefully that energy, or maybe getting just the blood flowing, will help us pick that energy back up. Yoga and other stress reducing activities can also be really beneficial. Specifically, research has looked at yoga in breast cancer survivors and has found that women have reported improved energy levels when doing yoga. So this isn't high intensity. Yoga can come in many different forms, many styles. So you can find one that maybe works for you and helps you to feel good once you've completed that. That's just a little bonus tip. Okay, this is a good time. I'm going to go ahead and take a sip of water before we talk about dry mouth. Okay, so dry mouth is often a side effect of many medications, chemotherapies. So how we want to combat that is keeping our mouth environment as moist as possible. So when we're eating our foods, how we can help that is avoid tough, dry foods. So something like a saltine cracker that might stick into the roof of your mouth and be really hard to swallow, or really tough meat, we're going to want to avoid. Instead, we're going to want to choose softer foods that won't require as much chewing and therefore as much saliva production, as well as go ahead and help our digestive system out by moistening them with gravies and sauces to help you chew and swallow more easily. You also want to sip on liquids throughout the day that can, again, one, just keep you hydrated in general, which can help with the dry mouth, but also just to, again, keep that local mouth environment, um, you know, moist. You can also suck on hard candies, popsicles, and ice chips because this increases saliva production. And make sure that you're providing oral care throughout the day. So this could look like, brushing your teeth before and after meals or using products specifically made for dry mouth. So some examples are Biotine, which I have a picture of some Biotine products here. They have some mouth rinses and some gels. Lubricity is another one. And then Moisture, I believe is how you pronounce the last one. But there are more, and you can ask your oncologist or even do a quick, internet search, and you might be able to find some good dry mouth products. Okay. So mucositis and mouth sores might also pop up during or after treatment. And sometimes, you might be thinking, okay, I experienced that during treatment. Why are we talking about this in the survivorship stage? Well, again, sometimes our symptoms resolve more quickly once we're finished, but sometimes they can linger. So even though maybe the treatment is behind you, we want to make sure that you're feeling your best and can eat everything that you want or need to be able to eat. So again, choosing soft, bland foods that aren't going to irritate those mouth sores is going to be important. We're not going to want to eat a lot of spicy or acidic foods or drinks that are going to kind of sting and make your mouth feel really uncomfortable. Those gravies and sauces are also going to be helpful with the mouth sores. Again, it's going to help just kind of reduce the time it takes your mouth to have to work in order to chew and swallow food. And we're going to, again, want to avoid those hard, dry foods. Drinking from a straw might also help so that you're not holding liquid in your mouth at such a large portion. That might be more irritating. Ice chips can help, just like you would put it on a sprained ankle or a wrist to kind of fight the inflammation and kind of numb and soothe the mouth. And lastly, that proper oral care, again, is going to be really important. So I'm going to move on to this next slide because I want to show you all the oral care rinse that you may or may not have heard of at this point in your journey. So a really gentle cleanser can kind of help get rid of some taste in your mouth and keep your mouth feeling very clean is something that you can make right at home. So this would be a quart of water with a teaspoon of baking soda and a teaspoon of salt mixed in. And you use it just like you would any other mouth rinse. You would just kind of swish and spit. I recommend doing this a couple times a day, ideally before and after meals. That way you're kind of, again, cleansing the palate before you eat. And then after you eat, getting rid of any lingering food particles that might affect your mouth sores or cause dry mouth or affect taste changes. This can also be really helpful with thick saliva or having excessive secretion. Some other tips for dealing with this is to keep the head of your bed elevated to at least 30 degrees so it's able to kind of run down. It's not getting kind of stuck in your throat or your mouth. Cool mist vaporizers might help to kind of loosen up these secretions. And portable suction machines can also help. Making sure we're staying hydrated is going to be really beneficial because if our bodies are making thicker saliva or too much of these secretions, again, that's dehydrating. It's taking fluids from our body to produce that. So we want to help stay hydrated, but it can also assist in thinning out some of those fluids. Mucinex, which often we use for like the cold or the flu, can be really beneficial. Um, all of these suggestions, but really the Mucinex has varying degrees of how much it might affect someone or how helpful it can be. So that might be worth a try. There's also glutamine rinses. So again, similar to the Biotine, there are rinses that you can purchase. There are some that are even prescription strength that you could rinse your mouth with a couple times a day that might help to break down the saliva. Adding seltzer water with pineapple, kiwi, or papaya juice can actually help break down the secretions because they have a certain enzyme in them that can help with this. So you might not want to try this strategy if you're also dealing with mouth sores, again, because the acidity might irritate your mouth. But if you're just dealing with a thicker saliva, this could be, an at-home kind of remedy to help break down those secretions. Magic mouthwash is another product that you can get over the counter to help with this. So again, rinsing a couple times a day. And then some people have a little bit of relief dissolving a tablespoon of honey in warm or hot water. I'm not exactly sure how that helps, what necessarily the science is behind that, but I know that that is another at-home remedy for many folks. Okay. Now, what about dysphagia or difficulty swallowing? Of course, the number one thing we want to do is choose easy to chew and swallow foods. So things like shakes, maybe scrambled eggs, custards, cooked cereals, things that don't require too much manipulation of our mouth in order to eat. But more specifically, you might need a specific modified diet consistency. And one way that we can determine, what diet you need to be on is by working with a speech language pathologist or speech therapist. They can help do an evaluation with you and figure out what you can safely tolerate and make recommendations based off of that. Cold or room temperature foods are probably best. We've all experienced putting, a piece of really hot food in our mouth and then swallowing, and then it feels so uncomfortable going down. We want to avoid that sensation. We don't want, any choking or just really any additional discomfort with that. Choosing again the moist and avoiding the dry foods will help. Using those sauces and gravies and providing the mouth care throughout the day will also help. All right. What about taste changes? This is a pretty common side effect with many cancer types when we are going through chemotherapy. That's a side effect of many of those chemotherapy medications. So, oftentimes with taste changes, we want to choose foods that actually have a tart flavor. Now, everybody's different. Some people end up being more sensitive to the sugary, sweet taste. Some people really only crave the salty foods, but many people can actually tolerate the tart flavors best. So doing citrus fruit, putting lemon wedges on your food, choosing lemonade, pickled foods, those can all be really, they can kind of help with the taste in your mouth. Again, of course, avoid them if you have a sore mouth or throat. Marinating your food so that you can give a variety of tastes throughout the day or on different products might help you from kind of turning off of certain things, like maybe certain meats or poultry that are helpful in you getting your protein in, but might just taste a little funny. Marinating them can give you a new flavor palette to try. Sugar-free lemon drops, gums, or mints can be helpful to kind of suck on throughout the day. And you can find one that tastes good to you and just kind of keep that in your mouth. And then adding lemon juice or other water flavorings, like even like Crystal Light packages or those Neo drops. A lot of folks really like if their water tastes a little funny, which, believe it or not, and some of you maybe experienced this, oftentimes when we have taste changes, it can affect how we perceive the taste of our water as well. So that's another tip to help you and stay hydrated when you're dealing with these taste changes. Feel free to season your foods by using various herbs and spices based on your tolerance. Adding condiments, just really keeping different flavors on your plate might help. And if you're really struggling with the sweet foods, frozen fruits will taste a little less sweet than fresh fruits oftentimes. So this might be an option to try if you're struggling to get your produce and your fruit in. And again, try this oral care recipe before and after your meals as a gentle cleanser to kind of start with a fresh palate before you eat something. If you are struggling with a metallic sensation or taste in your mouth, really the best thing we can do is try to avoid metallics on our plates, our serving utensils, And if you can, even the method of cooking your dishes. So if you have a different kind of pan that's non-metallic, that might be a little bit better while you're dealing with this taste alteration. Okay, I think this is our last side effect before we move into managing other chronic diseases. So, oxaliplatin is a chemotherapy often used with colorectal cancers. And one of the big side effects of this is sensitivity to cold. So, this can be touching the cold or being in a cold environment. So, it's February, although we have had a very warm February so far. But in general, going outside, you might become a bit more sensitive to the cold. So you want to make sure you're covering your most of your skin, your hands, and even your nose and mouth if possible. You also want to avoid being in rooms that are really, the air conditioning is really high. So you maybe want to bump up your AC a little bit. And of course, with food, naturally, you're going to need to or want to avoid cold and frozen foods and beverages. So at least we want it to be room temperature, if not, a warmer or a hot dish. This also might be a good time to enlist family and friends to help with food prep if it's really a struggle for you, chopping cold produce or reaching into the fridge too often. Um, you also will probably want to avoid ice packs or ice cubes during this time. And if you do have to handle any cold or frozen food, go ahead and use gloves, and um, that might reduce the just your contact with those items. Okay, so now we're going to move into the next section of today's PowerPoint. We're going to talk about what we can do to help keep ourselves healthy outside of our cancer diagnosis. So, as I mentioned earlier, and really as we talked about in the very first session of this reducing risk series, is that having a higher BMI or a higher body weight, carrying extra body fat and adipose tissue, does put us at increased risk for cancer recurrence. So, what we want to do is make sure that we are maintaining a healthy body weight for ourselves. But again, the good news is oftentimes we see a reduction in risk, even with a modest weight loss, if we do have extra body weight. So, this is really a topic that we could have, full other sessions on. So, I'm not going to dive too deep into weight management because it's really going to vary from person to person. But with that being said, a really helpful tool for managing our weight and making sure we're giving our body the nutrients it needs to stay nourished while supporting a healthy body weight is something like the plate method, or in this case, the Harvard Healthy Eating Plate. So we've seen in the past sessions, we've looked at the American Institute of Cancer Research's New American Plate. This is very, very similar. And this is also very similar to the plate method. It just kind of gives you a little bit different visual so you can kind of pick what's going to be most helpful for you. So what we want our plate to look like is half of our plate being non-starchy vegetables and or fruits. So really we want to aim for that variety. So making sure we're getting both throughout the day is going to be ideal. And of course, these foods tend to be lower in calories, which, sure, calories are a part of the weight management puzzle piece, but also they're going to help you get that 25 to 38 grams of fiber, which will also help you stay full and satisfied for longer. Same thing with whole grains. So we want about a quarter of our plate to be a whole grain or a high fiber starch. So a whole grain is going to be, the quinoa, oatmeal, wild rice, whole grain pastas. Or we could choose a starchy vegetable like sweet potatoes or corn or green peas as kind of our carbohydrate source in our meal. And then lastly, we want to round our plate out with a healthy source of protein, whether we're choosing a lean animal protein, a fish, or maybe even a plant-based protein. So all of these work together If we only focus on one of these sections, we're going to be missing other components of the puzzle piece. So, for example, if all we ever ate was fruit, we would be missing out on that protein. We're not going to feel very full. We're going to end up overeating. And maybe we're going to end up getting too many carbohydrates, too much sugar. Whereas if we balance that fruit with a healthy protein and maybe with some other fiber source, we'll feel more full, more satisfied, and we'll be getting other sources of energy for our body, as well as those other micronutrients that we really need. So that's a plate. We also want to include maybe a healthy fat at most of our meals and moderate to small amounts. So our healthy fats are going to be typically be coming from plants. So things like avocados, nuts and seeds, olives, olive oil, avocado oil. Those are all healthy sources of fat. So it can be helpful to include moderate portions of those fats at our meals because fats do help our body absorb certain nutrients. They also, again, will help us stay full and satisfied longer, and how heart healthy fats can be really beneficial for that chronic disease and heart health risk. So we want to make sure we're including those, but not too many, as any kind of fat does tend to be higher in calories. So it's all about a balance. So if you're looking at, maybe olive oil and you're thinking of using that as a salad dressing, we want to stick to what the portion size of olive oil would be. Lastly, our beverages can help us with that weight management. So, as we have discussed in the previous session, one of the core recommendations for reducing cancer risk is avoiding those sugar sweetened beverages. And the main reason for that is they add up in calories, which can, they don't offer much other nutritional benefit. And that can therefore make this weight management piece a little bit harder. So, of course, water is the best thing for us. But choosing, maybe herbal teas and coffees with little to no sugar, those can be a good option. We can have moderate amounts of milk and dairy products, so about 1 to 2 servings a day. And then limiting juices to about one small glass, so 4 to 6 ounces a day is what is recommended for our kind of upper limit of juices. And when I say juices, this is 100% fruit juice that doesn't have additional added sugars in. Okay, so this is really a good starting point for weight management. Like I said, there's a lot more to it. Like you'll even see at the bottom of this picture, that little in the left bottom corner, it says "Stay active" with the little picture of the man running. Of course, that's a part of the puzzle piece, and there's so much more that goes into this as well. Okay. So another big consideration for our survivors is bone health. Most cancer survivors are at a higher risk for bone loss and osteoporosis than the general population due to different cancer therapies, whether it was the chemo or maybe a hormone therapy that you might be on for longer term use. And really, with the general population, we recommend that women get screened for bone density at 65 and men at 70. Of course, if there's other risk factors, we might want to push that up. But for many cancer survivors, we want to go ahead and start this, regardless of your age, depending on the treatment that you went through. Another statistic, 75% of multiple myeloma patients have osteopenia or osteoporosis. And so what osteoporosis is it's a bone disease that really, we might see pictures of it where it looks like there's holes or perforations in the bone, kind of starts to become a little bit more brittle, and you're at higher risk of fracture. We also see it in many stem cell transplant patients with about 50% or as many as 50% of those patients starting to develop osteoporosis. And the duodenum is also plays a role in this. So the duodenum is a part of our GI system, and it's a primary absorption site for calcium. So any surgical intervention that either bypasses or removes the duodenum might increase bone loss because your body's not able to absorb quite as much calcium. So in that case, if this is you, if that applies to you, we definitely want to monitor your bone density and kind of go from there in making recommendations. So, what can we do to be proactive about our bone health? Well, the number one thing we can do is make sure we're getting calcium and vitamin D in the diet. So, calcium is that main nutrient that makes up our bones, and vitamin D plays a big role in our bone health as well. So, we'll go over in just a second some sources of calcium and vitamin D in the diet, but we definitely want to make sure that we're thinking about those nutrients when we're planning out our meals and our dietary patterns. Beyond that, physical activity is very important for bone health. Weight bearing exercises like walking, jogging, and climbing the stairs, or even resistance or weight training or balance exercises, all kind of work not just our muscles, which do support our bones, but they can help to make our bones more resilient. So this is extremely important. I always talk to my breast cancer survivors about, making sure we're taking care of our bone health. It's never too early to start, and it's never too late to start either. Lastly, we want to avoid substance abuse. Using tobacco products can affect our body's absorption of calcium. And same with alcohol. Alcohol is also linked to higher risk of osteoporosis. So again, that recommendation we've been over earlier in the series is limiting to 1 drink a day for women or 2 drinks a day for men if you're choosing to drink. Okay. Um, so let's look at some calcium sources of food. So our highest calcium sources of food are typically going to be our dairy products. Oftentimes these are fortified with with calcium. And orange juice is also actually fortified with calcium and vitamin D a lot of the time. So again, if you are going to choose to drink orange juice, we're going to limit that to about a cup, no more than a cup, or 4 to 6 ounces if you want to cut that back a little bit further. Canned salmon and sardines that have the soft bones are going to be a good source of calcium. Many cereals are fortified with calcium. And then there's also many plant foods that have calcium. They're just going to be at lower amounts than dairy products. So if you're avoiding dairy, if you're avoiding a lot of these meat, a lot of the animal products like the salmon or the sardines, you do have to put in extra consideration for some plant foods that are going to have calcium. Tofu and soy products are going to be a great source of it. Almonds, chia seeds, and certain vegetables are also going to have calcium. But again, you just have to maybe put a little bit more intention on that because as you can see, a half cup of cooked broccoli, which is a serving, is going to give you 1/6 of the amount of calcium that a cup of milk would give you. This is again not an exhaustive list, but just some of the foods that are higher or contain calcium. Okay, so let's look at vitamin D. So there aren't too many food sources of vitamin D, unfortunately. We do get it in oily fish like the salmon, the trout, again, those sardines, and even canned tuna. So if you're not consuming much fish, you're probably not getting too much vitamin D in the diet. Some mushrooms actually have vitamin D because of how they are grown, how they absorb UV light. So you can get some in mushrooms. And then from fortified foods. So again, many milk products, orange juice, yogurts, cheeses have vitamin D added into them because they know that many people are consuming these products for bone health. So instead of just giving you the calcium, they're going to go ahead and give you a little bit of that vitamin D that's going to work together with the calcium to protect your bones. Okay, before I talk about heart health, one thing I will say is, we've talked about supplements throughout this series, and oftentimes, your physician, your oncologist, or maybe your dietitian will recommend that you go ahead and take vitamin D or calcium supplements. Of course, if you can get it from your food, That's always best. That's always what we try to aim for first. And sometimes more isn't better, especially with calcium. Oftentimes, our calcium is absorbed in smaller amounts, like the amounts we would get from food. So, if you are struggling to get it in your diet, just work with your physicians to make sure that you're taking calcium at an appropriate dose for you. That's going to be enough, but maybe not too much. Okay. So now let's talk about heart health. So, of course, we want to keep our hearts healthy. And we're in the surviving and thriving stage. The last thing we want is any additional chronic disease or heart issues down the line. Two components of the diet that can affect our heart health are going to be sodium and saturated fat. So, we've talked a lot in the past couple weeks about the good foods that we want to make sure we're getting in. So, I really am just going to highlight these two nutrients as ones we want to be careful of and monitor. So with sodium, so sodium or salt are interchangeable words, and we get this in abundance in our diet. So it's recommended we get no more than, 2,300 milligrams of sodium a day if we aren't, if we have no predisposed heart conditions or hypertension. So 2,300 is that number. Really recommending between 1,500 and 2,000 just to be safe. Um, but most Americans are consuming about 3,400 to 4,000 milligrams of sodium a day. So really doubling that recommended amount. To put it into perspective, 1 teaspoon of salt is 2,300 milligrams of sodium. So we want to be careful there. We want to make sure we're not doing too much of that. Okay, saturated fats, which are the kind of fat that are usually found in animal foods, are one that we want to stay away from because it has been linked to higher risk of high cholesterol, atherosclerosis, and other heart conditions. These are the fats that are usually solid at room temperature. So butter, the fat that you see on a beef, on a cut of steak, the white marbling in your meat products, whole milk, whole fat dairy. And then also tropical fruits. So things like coconut oil and palm oil are also going to be significant sources of saturated fat. Sometimes this recommendation is going to depend on just what your health needs are, but just keep that in mind. In general, the consensus is we want to limit these for heart health. Okay. So I'm going to kind of breeze through these last few slides because I know that there have been some questions in the chat I want to make sure I can answer today. So I think this is the last one. We want to make sure we're protecting our blood sugar levels to reduce the risk of diabetes down the line. Weight management is a big part of helping to reduce diabetes, but what we eat is also going to play a big role. When it comes to choosing our carbohydrates, we want to choose higher fiber carbohydrate sources. This helps to keep your blood sugar more stable than a refined carb. And you can help pair carbohydrates with protein, again, to help kind of slow how quickly your blood sugar is being digested to help keep that blood sugar stable. We also want to limit added sugars. So not natural sugars that are found in fruit, although if you do have diabetes already, you may need to be conscious of how you're pairing your fruit with other foods and your portion sizes. But really, I'm talking about sweets and the added sugar that are snuck into things like our beverages, condiments, etc. But don't forget that carbohydrates are not the enemy. They are our body's preferred source of glucose, and we do want to consume them as a part of a healthy, balanced plate to make sure we are able to get all of our fiber and nutrients in. So we've been over this the past couple of weeks, but I just wanted to highlight that the last bullet point for reducing cancer recurrence is even after a cancer diagnosis, we want to follow all of the other recommendations for cancer prevention. So the limiting the alcohol, breastfeeding your baby if you can, limiting the red and processed meats, and getting all of those great whole food nutrients in are going to be really key to your health if you're and when you're able to do these things. I believe I showed this in one of the first two sessions, but a great website if you are struggling with some of these side effects and it's making cooking harder is this website cookforyourlife.org. You can actually filter the recipes by symptom or side effects. So here you'll see you can look for low fiber diets if you're having struggles with diarrhea or easy to swallow foods. So this is a great recipe and a recipe resource for you. Lastly, today we talked about really broad recommendations. Feel free to talk to your care team about making a plan for you that's going to be much more specific. Again, I am the survivorship dietitian for Northside Hospital, so you can always reach out if you were a Northside Hospital Cancer Institute patient. You can uh, email or call the phone number and email on the screen. If you're not a Northside patient, your doctor's office where you received care will probably have similar resources available. So go ahead and give them a call if this is something you're interested in, and hopefully they can get you plugged in.
Thank you for joining Cancer Support Community Atlanta for this program. If you're interested in other live or recorded programs, please visit the online program tab of our website, cscatlanta.org, or follow us on Facebook. We'll be sharing additional information on upcoming programs.